Hi everyone, Felix here, Advanced Clinical Practitioner with Eden Clinic. Welcome back to part 2, the final instalment of how Tadalafil can be used beneficially alongside TRT. If you haven't seen part 1, please click the card just up here in the top left and have a watch of that, then come back here and join us for this section. So continuing on from where we left part 1, we were looking at the positive benefits of Tadalafil when used alongside a well-designed TRT protocol. Now, there is evidence in the literature that supports an interesting side effect, and that's a reduction in serum estradiol levels. I have personally observed this in my own clinical practice, and the limited studies around this topic do demonstrate this. However, I think it is negligible and not something that is necessarily required. The caveat from the evidence base around this particular effect that I saw in one study in 2016 by Aversa et al. Is that the reduction in estradiol levels was primarily only observed in those without excess central adiposity, i.e. lean men, and not so much in those that were overweight or obese. So that's further motivation right there, guys, to moderate your diet and exercise. So on the subject of weight management, those patients on TRT who do regular resistance training may also see an additional benefit from Tadalafil and reduced muscle soreness and decreased recovery times due to the increased blood flow to the muscle groups being stressed during training, due to that vasodilatory effect of Tadalafil that we talked about in the first video. Finally, another useful benefit that Tadalafil confers is demonstrated in the 2006 study by Forrester et al. That showed that Tadalafil has a positive effect on vascular endothelial cell regeneration by increasing the amount of endothelial progenitor cells and CXCR4 expression, which is linked to the CGMP cellular messenger system, resulting in improved repairs of vascular damage. So put more simply, it helps to improve the repair and recovery of the lining of our blood vessel walls, thus improving cardiovascular health and longevity and reducing the likelihood of thromboembolic events like stroke and heart attack. So what about dosing then? Well, Tadalafil has a half-life of between 17 and 21 hours and a peak plasma concentration time, or Cmax, of approximately 2 hours. So stable serum concentration levels can be achieved quite quickly on a daily dosing regimen. Now, if we were to use Tadalafil for its primary clinical indication of erectile dysfunction, you would look to utilise a dose of between 10 and 20 milligrams daily, and that would be taken about an hour and a half before planned intercourse. However, there's evidence that taking smaller doses daily or even every other day can facilitate stable serum concentration levels. Personally, I tend to look at using doses of between 2.5 to 5 milligrams daily via oral administration, and will titrate that dose to the desired effect, with some patients even finding a dose of 10 milligrams every other day to be more beneficial. And at Eden Clinic, we'll work closely with you as the patient to find the best fit for your individual needs. So, side effects. Are there any side effects? So, as with all medications, there will always be a list of side effects. And the most common reported side effects for Tadalafil are initially headache, back pain, dyspepsia, so acid reflux or indigestion, facial flushing, and nasal congestion. Now, anecdotally, in my own clinical experience, these side effects tend to settle between weeks 2 and 4 on a daily or every other day kind of dosing scheme. If the dyspepsia or acid reflux doesn't settle, you can first look to moderate your diet, and if there's still no relief, you can approach your GP about medications that maybe might be able to help with this, such as PPIs. So to summarise, the benefits of using Tadalafil in smaller daily dosing manner alongside TRT are the relief of erectile dysfunction symptoms, increased cardiovascular health through endothelial cell regeneration, relief of symptoms associated with BPH, so benign prostatic hyperplasia, blood pressure modulation in some cases, estradiol modulation maybe, and the potential for reduced muscle soreness and decreased recovery time post-resistance training. So there we have it. Tadalafil is not just for erectile dysfunction, it has many other benefits alongside a well thought out TRT regimen. Anyway, that's it from me for this one, guys. And if you enjoyed the video, please do hit like and subscribe to the channel to make sure that you don't miss any of our future uploads. And be sure to hit that bell notification. I'll see you in the next one.